Near 5 minutes past the hour, we can go ahead and dive right in. Thank you again to all of you for joining us today. We are really excited to have, like I said, so many familiar faces in the crowd. I know we have many members of our community present today, many of our partners for the hotline today, and of course, many of our private and public funders. So we'll say a special welcome to those of you from the Illinois Department of Human Services and the Cook County Justice Advisory Council. We are so happy to have so many of our stakeholders here today. All right, well, we can go ahead and dive in. Welcome everyone to the first Measuring Safety publication and Lunch and Learn of the year. My name is Shelby. I use she, her pronouns. I serve as Policy, Advocacy, and Research Manager here at the network. I'm joined today by many of my colleagues, but my co-host for today's presentation is Amuna McClurklin, who serves as our Data and Research Associate. We will be hearing from her later today in the presentation as well. With all of that out of the way, we can kind of dive into what we will be discussing today. Just to give folks a quick kind of roadmap about what we'll be covering in today's presentation, we've got some groundwork to lay, some simple introduction, and then we'll dive into the numbers. We'll start with our contact data to the Illinois Domestic Violence Hotline. Then we'll talk a little bit about our district contact database, a relatively new resource we're excited to teach you all about. Then we'll move on to talking about survivor needs and some of the hotline programming that has emerged in the last few years to try to meet some of those needs and bridge the gap when we see our service sector is strained. So lots of great stuff to get to today, and we are happy to have you here. So we can start with some of that introduction. Just for anybody who's new to Measuring Safety as a project or perhaps to programming from the network, we always think it's useful to introduce ourselves. So the Network Advocating Against Domestic Violence really leads a coalition of organizations that are working to end gender-based violence. And we do that in a myriad of ways. We have more than 45 different direct service providers in that membership network who provide domestic violence, sexual assault, human trafficking services to folks in the wider Chicagoland area. We reach and support survivors of domestic violence directly by operating the Illinois Domestic Violence Hotline. And of course, that is the subject of today's discussion. We also reach them through some of our other really wonderful programming like the Survivor Fund, which is, to our knowledge, the largest community-based financial aid program for survivors in the country, and through our very passionate housing advocacy team as well. We also serve our member organizations who work in and across the service sector through training and resource development, really making sure people have the tools they need to do this work and to do it well. And here on the Policy Advocacy and Research team, we advocate for policies that improve the lives of survivors and, of course, the organizations that serve them. What is measuring safety? You may be asking. It is a series of data reports that we publish every year here at the network, and they're really designed to help us assess experiences of gender-based violence and all of the different responding systems and service providers that exist here in Illinois. The goal of each report is really to learn from survivors and our providers about the nature of violence, the gaps in services and systems, and what we need to move on, to repair harm and to prevent further violence. Of course, we do like to name that measuring safety is not a scientific study with causal conclusions, but we use rigorous quantitative and qualitative methods to really draw on a wide variety of sources to tell a story about whatever program or topic our reports are focusing on. And today, with the hotline being at the center, we have such rich information, not only from all of the records that document what these calls look like, but also from our passionate hotline staff and from the survivors we're speaking to themselves. Really, all of them come together to paint this picture of what survivors need here in Illinois in 2025. We really hope that you come to, use and imagine measuring safety as a tool for advocacy, for securing funding, and for engaging in public education. We design it with that in mind so that you can talk about the work that you do or the work that you fund and how effective it is. We always want to make sure you know where our sources are coming from and what we draw on in these reports. And in this case, we're leaning on three primary sources. iCarol is a web-based database that's used to track the vast majority of the daily activities that happen in the hotline's day-to-day operations. Our VERAs, those victim information and referral advocates, take those calls and record an incredible amount of information about them after each one. Our VERAs have also given us really wonderful stories that kind of help paint that broader picture about, beyond the numbers, what these survivor calls look and sound like. Those are originally produced for grant reporting, and then we take a look at them and kind of curate them here for you in the report today. The last major source of data that we work with is our Uber Health data. This is what underlies our Safe Rides program. Uber Health is similar to, but fundamentally different from typical Ubers in that they allow us, the hotline, a third party, to confidentially coordinate rides for our survivors who are calling. So that way, no personal information has to be shared, and we keep things really secure and safe for the survivor. We export a great deal of data from that Uber Health database directly in order to include it in the report. The program at the center of today's presentation is, of course, the Illinois Domestic Violence Hotline. And so we like to make sure you have a little bit of background on, where the program comes to us from and how it operates. So in 1998, the city of Chicago introduced a free 24/7 helpline specifically for survivors of domestic violence, really aimed at, providing connections to local resources. A decade later, in 2008, the hotline expanded its service area and started to reach the full state of Illinois, and it has been the statewide hotline ever since. The network has operated the hotline for these past 26 years, and we've answered more than 750,000 calls with confidence and care, something we're really proud of here. And of course, if you are interested in the hotline, if you need to refer someone to the hotline, you can reach us in 240 different languages through a combination of really intentionally curated bilingual, multilingual staff and our use of the language line. We are available 24 hours a day, 7 days a week, 365 days a year. And we can be reached at call, text, or via chat on our website. The number is right here, and I always recommend folks put it in their contacts so that you always have it available when and if you need it. Of course, I offered a quick thank you to some of our really wonderful funders at the top of this call, but we would be remiss if we talked about all of this data, what it tells us about survivor needs and services, if we did not first thank our incredible hotline staff who are really at the foundation of this report. So I will offer that now, our very deep gratitude to the staff of the Illinois Domestic Violence Hotline for their dedication to serving survivors truly at every hour of every day. Their skill, their compassion, and their commitment to excellence ensures that survivors across Illinois are connected to the information and the services that they seek. The data that they collect from each call serves as the foundation for this report, and their stories help to bring survivor experiences to life. All of that groundwork behind us, we can now start to move into the numbers, which I'm sure is what you all came here for. I will also offer, we'll have links later in the presentation today, but you can find the full report on our website. It is linked front and center on our banner, but you can also find it in the Measuring Safety tab of our website. So let's start by talking about contacts overall. In 2025, the hotline saw another record-breaking year. We came in at just under 70,000 contacts. When I say contacts, I want you to know I mean any method of contact. So that could be a call, a text, or a chat. That's a 17% increase in contacts overall from the last year, so from 2025 to 2024. And it's also a staggering 181% increase from pre-pandemic levels, specifically in 2019. So we've just seen a dramatic growth in contact in these last few years. Specifically in 2025, Chicago contacts had officially doubled since pre-pandemic 2019. That's a really sort of remarkable threshold to imagine that just, 5 or 6 years ago, we were operating at half the scale that we are now. You'll see here some additional stats broken out on the side with this lovely graphic from our report. Obviously, we see predominantly calls to the hotline, about 92% of our total contacts, but we do have folks reach out to us in the thousands via text and via chat. And just to give you a sense of what that volume of calls really looks like on the day-to-day, on average, we're receiving 191 contacts in a single day, which is a really remarkable pace to be moving at. Those contacts do come to us from all over the place. We received contacts from 48 US states last year and 6 international locations. You might wonder why we get calls from outside of Illinois, and of course, those are varied reasons. But we know that many survivors live in Illinois and perhaps flee to a neighboring area, or perhaps they are from a neighboring area and planning to flee to Chicago. We know that many of our loved ones live outside of the state and are perhaps calling, looking in and looking for resources for a survivor that lives in Illinois. And many of us live in states that are in communities that are border communities. So folks who are in Indiana, Wisconsin, Iowa might just be a hop and a skip away from Illinois, but they're calling from another state. So that's why we have such wide-ranging reach. As I mentioned, we receive calls in more than 240 different languages, or at least we're equipped to do that. And we see a wide variety of non-English languages throughout the year. The top 5 are presented here. Spanish is overwhelmingly our #1 non-English language of choice. That accounts for about 76% of all non-English calls. But we also see other languages emerging again and again, languages like Russian, Urdu, Arabic, and Polish. We talked about this really incredible growth and kind of trend line, and I just want you all to be able to take a look at this yourselves. To orient you to this graph, you'll see that our overall Illinois contacts are listed here in pink. That teal line is Cook County, and the Chicago line is tan at the bottom there. Something I will flag for you is that we break out our contact data in lots of different configurations based on location. And so that number you heard at the top of our call, that just under 70,000, is the total contacts from anywhere. But as we narrow in on certain locations like Illinois, Cook, or Chicago, you'll see those numbers vary a bit. So always take a peek as you're reading the report at where the contact total is coming from so that you don't get numbers mixed up. Clearly, we've seen that really dramatic growth that I mentioned here visible on this chart. And what we want to do is kind of ground what that trend might mean and what it doesn't mean here at the top of our call. Growth in contact to the hotline does not necessarily mean that there has been a growth in domestic violence experiences. It could be in part because there are more experiences of violence, but certainly not in whole. What it does demonstrate is that with growing awareness of the hotline, people are responding to knowing there are resources with asking for help. This is help-seeking behavior. And what we need to know and recognize, and of course always prioritize, is that when survivors are seeking help, when they're taking that brave step of saying, I need assistance, we need to have a service environment that is well-resourced enough to meet that need. And of course, recognizing that as need grows, our service environment needs additional resources as well. Just to give you kind of another picture of what contacts look like across the state, we had contact from 96 of 102 counties in Illinois last year. And just to kind of orient you to this map, it's not a standard heat map, but we've called out some different major trends. So the dark teal counties, which you can see are predominantly Chicagoland, right? Our Cook and Collier counties at the top. Those are our highest contact counties. The counties in pink reflect our largest increase in contact, and that's percent increase. So note that if somebody had like relatively small contacts and then there was a jump, that's going to be a big percent change, even if it's only like a small numerical change. But you'll see that our largest increases are really coming from more of central and southern Illinois. Our purple counties reflect our largest decreases, again, by percent change in contact, here again, kind of in more of central and southern Illinois. And that the tan counties reflect a place where we have not gotten contact for the last 3 years that contacted us this year. And so in this case, I believe that's Edwards County, down towards the bottom of the map where we got our first call. No contacts, you'll see, are in very few places because, of course, we had really wide reach in 2025. But counties like Polk County, Scott County, Brown, and let's see here, Calhoun are the counties where we did not hear from folks this past year. It's helpful to just kind of get us oriented to see where do folks perhaps need additional information to know that the hotline is a resource to them. Where are we building momentum, and where do we have really strong inroads? Growth across the state, of course, we want to kind of zoom in on some of those counties where we do see the most growth year over year. So this chart excludes Cook, because Cook is always our #1 county of contacts. And this is our next top 5. You'll see that DuPage took the lead in 2025 as our highest contact county outside of Cook. And it took that spot from Lake County, which was the highest county in 2024. All but one of these counties saw significant growth in 2025. Lake did have a dip. Cook County itself had a significant increase. It saw a 30% increase in contacts from 2024 and 135% increase since pre-pandemic 2019. So Cook, much like Chicago, hit that doubling threshold in 2025. This data really continues to highlight the importance of services in these areas and how the increasing demand is sort of emerging from these counties. The more calls we get, the more resources we need to be able to point people to. We can also take a look at what this growth was like in Chicago. This is a more traditional heat map. It might be a little more intuitive to read. And you'll see here that contacts were not evenly distributed across the city, right? We've called out the top 5 zip codes where we saw highest contact in 2025. And I've included the neighborhoods here because I don't know about you, but I do not always know what neighborhood is in what zip code off the top of my head. So our #1 zip code in Chicago was 60617. That includes places like South Chicago, South Deering, East Side, and Calumet Heights. 60620 includes Auburn, Gresham, and Washington Heights. 60649 is predominantly South Shore. 60640 is Uptown, Lincoln Square, Edgewater, that kind of area. And 60622 includes Westtown, Wicker Park, and Ukrainian Village. You'll see that these are really kind of scattered all over the city. We've got the far north side, the far south side, the far west. And what that tells us here again is not necessarily that there is more violence in these communities, but that there are people looking for resources in these communities. And these are the places where we need to make sure we have what they need when they call. Chicago overall had a 25% increase in contacts in 2025 compared to 2024. And that 122% increase from 2019, which is where we say contacts officially doubled. That is a brief overview of all of our kind of location-based data. And we know that many of you are coming to us from a place of wanting to know more about your community. So we're really excited to share a little bit more about our district report database. So all of you can access the full written report associated with this presentation on our website. But now we have a really exciting interactive tool to offer you too. So this is designed to really allow us to break down contact data about the hotline into legislative districts. Of course, we hope that it is a tool for our public leaders to make informed decisions about resourcing and supporting services. And of course, we hope that it allows our community members to really guide those conversations with their elected officials. And this comes out of feedback from all of you. So we were hearing there was this demand a few years ago and wanted to make sure that we were kind of creating a way of communicating about that legislative level data. And so we published 2 years ago an appendix to measuring safety. It was static, but it included all of these different legislative reports that included the Illinois House and Senate districts, as well as Chicago wards. When we got feedback on that initial attempt, we heard that it was super useful information in a not very useful format. And folks were looking for a more interactive and printer-friendly version of that information. So we put our brains together and we generated this new idea, which is our searchable database for district hotline reports. And they come in these really beautiful printable pages that should be really easy to access before your next meeting with an elected official or perhaps your next meeting with your community. You can search these by the district themselves or by zip code. And the way we construct these, because of course our zip codes do not perfectly overlap with our neighborhood lines or our district lines, is that we established sort of a threshold for registered voters in every zip code. And then if they met that threshold, they were allocated to the relevant legislative district. There's more details if you care about that process on our website. You'll see you can now access congressional district data, our General Assembly, House and Senate data, and Chicago ward data on our website, both 2024's and the brand new 2025 data. We published this last year in July, sort of separate from our hotline report launch. And we know that that means many of you don't know about it yet. So we're really excited to share. And I can give you a quick preview of what this looks like on our website. You can scan this QR code or go to the-network.org and click over to the Policy Advocacy and Research Team's district database to see more. But it's a really straightforward process. We've got tons of filters at the top of this page. You can find your relevant legislative district. And we don't want you to feel like you're all on your own here either. You can see at the bottom, we've provided definitions and context so that you are prepared to talk about these numbers confidently with whoever in your community you're having that conversation with. We really hope that this serves as another really useful tool in your belt and a way of leveraging all this rich information we have about the hotline into action on behalf of your communities. All of that from me. I will now pass it over to my colleague Imuna, who's going to tell us a little bit more about survivor needs and how we've responded to some of those as they've evolved over the years.
Thanks, Shelby. Shelby introduced me before, but my name is Imuna McClurklin. I am the Data and Research Associate for the Policy Advocacy Research Team here at the network. In this section of the presentation, we're going to be discussing the various types of survivor needs that we track and the notable trends that we see within them. The hotline tracks over 40 different service needs among callers, and we record every need mentioned by each caller. So when a caller calls with a variety of needs, we track every single one of them to make sure that we know what survivors across the state are asking for. The Measuring Safety Report covers trends in the top 10 survivor needs articulated in calls in 2025. And in this presentation specifically, we'll focus on those top 10 survivor needs, as well as shelter and affordable housing trends, legal advocacy trends, direct financial support trends, including the Survivor Fund and requests for transportation assistance. You can go to the next slide, Shelly. Thank you. Typically, we see that the top 10 needs among survivors in Chicago and Illinois are the same, but they don't always have the same rankings. So number 1 for Illinois might be number 2 for Chicago. For the vast majority of service needs requests, we see that survivors are exhibiting help-seeking behavior. They're trying to get assistance for the issues that they're facing in their DV relationship. But some service needs requests are tied specifically to hotline programs that were established to support survivor needs in some service areas. So the difference in ranking between regions can be contributed to the availability of those programs. When a supplemental hotline program comes up in the report, we will talk about it in a later section of this presentation, but I will highlight the difference between a service need that is a survivor seeking help and a service need tied specifically to a hotline or network program. Number one, the top service need in Illinois in 2025 was for information, and the top service need in Chicago was for DV shelter. Information, request for information is when survivors call for information regarding DV to understand the nature of DV, information about different services that they are looking into, but they are not directly transferred to a service provider. It also includes safety planning when VERAs assist survivors in planning around their abuser and finding tools that will help keep them safe in their specific situation. Um, DV shelter uh, includes context for survivors looking for shelter availability, looking to be transferred for shelter. We see that information and DV shelter are either number one or number two for Illinois, just switched. So for Illinois and Chicago, sorry, just switched. Number two in Illinois is DV shelter, and number two in Chicago is information. We see that they're so closely aligned because they go hand in hand for a lot of survivors. A lot of survivors who are calling for information are calling for information about DV shelters. We'll go in more detail about that in that connection later in the presentation. We also see that the top three service need for Illinois and Chicago were direct links to services. That is when a survivor is connected directly to a service provider via a warm transfer. So a VERA will call the service provider, make sure that they have availability to talk to the survivor, and then transfer that survivor over so that we know that survivor was directly linked to that service. Um, we see that number four for both Illinois and Chicago was crisis intervention and emotional support. Survivors call the hotline sometimes in emergency situations, um, sometimes from the hospital, sometimes from the police, and they call sometimes experiencing a lot of emotional distress. And VERAs will support that survivor, will listen to that survivor, will make sure that survivor feels heard, so that the survivor is getting the care that they need during these high stakes situations that they're seeking help in. And we see that a rather significant proportion of calls involves VERA helping survivor through that crisis emotional state. We also see that the top five service need in Illinois was affordable and transitional housing, and the top five service need in Chicago was the after hours OP program. Both of these service codes are tied either fully or in part to supplemental hotline programs. Um, and so we see that supplemental hotline programs are very popular in that survivors call the hotline looking for links to these programs or information about these programs at very high rate. We will talk more about that later in the presentation, but I think it's important to highlight here how these programs are folded into demand for hotline services. Um, Understanding the top 10 needs among survivors help us to evaluate the gender-based violence service environment. It helps us to understand how are we providing services to survivors and how those services provided stack up to survivor need. It helps us to see where need outpaces demand and understand kind of gaps in the field. And so it's really important to keep track of what types of services are most popular amongst survivors. Number the top six service need in Illinois and Chicago both have to do with orders of protections, but there's a slight distinguish between them. The After Hours OP program is a supplemental hotline program available in Cook County, in which survivors get assistance filing for emergency order of protections after hours, while legal advocacy for order of protection deals with a survivor looking for legal advocacy assistance with any type of order of protection needs. They're very similar but slightly different, but they do both show that there is a high demand for assistance when it comes to legal advocacy for order of protection, and we'll talk a little bit later about what could be contributing to that. We see that the seventh top service need in Illinois was legal advocacy for order of protection. And then number 7 in Chicago was affordable and transitional housing. Number 8 in Illinois and Chicago both have to do with direct financial assistance. In Illinois, it was transportation. In Chicago, it was the Survivor Fund. Both help survivors um, who need financial assistance in certain situations, and both deal with in-house network programs. We will also talk about that a little later in the presentation. Number nine for Illinois was counseling services, and number nine for transportation. For Chicago was transportation, and then number 10 for Illinois was the Survivor Fund, and number 10 for Chicago were counseling services. So again, by looking at this top 10 list, we can see how the needs of survivors are being expressed through repeated calls to the hotline for these services. We continue to see that domestic violence shelter is a top need amongst survivors articulated at the hotline each year. In 2025, there was a record breaking 20,623 requests for shelter. Sorry. Hotline staff maintain communication with every shelter in the state to establish availability, ensuring that when a survivor calls, they are being connected.
Hola, buenas tardes.
Hello. They are being connected to um, the nearest shelter that has availability for them. We can see that shelter availability has increased very significantly, especially since 2022. And that increase
Hola, ¿alguien
and that increase impacts shelter capacity. As shelters struggle to meet the growing demand for domestic violence shelter, uh, we see that there is an increase in the lack of availability for beds and cribs across the state. So in Chicago, for nearly half of the year, there were no shelter beds or cribs available. That's a 21% increase compared to 2024. In the suburbs, there were nearly a quarter of the year where there were no beds or cribs available. You can see that there are nearly 100 shelter beds that exist in Chicago, 163 in the Chicago suburbs, and then 444 across other central and southern counties in Illinois. And when you look at our chart from the previous slide, you can see that there is an incredible amount of demand that can be met by this number of shelter beds. And so as shelters struggle to meet the growing demand for domestic violence, we see that effect on the help-seeking behavior of survivors. When shelters are full, survivors call the hotline repeatedly. Sometimes they call multiple times a day, sometimes they call multiple times a week until a bed opens up. And if a survivor keeps calling and their need continues to go unmet for long periods of time, they not only face danger, but they also grow discouraged with the service environment and they are less likely to ask for help again. We know that the point in time when a survivor seeks DV shelter can be one of the most dangerous because it is a point in time when the survivor is attempting to leave their abuser. It's a point of time that is associated with high lethality. So it's really important for survivors to feel like if like when they choose to leave that there is support available for them. Um, and and the hotline helps survivors be able to find the resources they need to make that happen. We have scattered throughout our report and also through this presentation stories from Veras who have answered calls and their experiences answering calls and assisting survivors with their needs. We feel that these stories are really important in understanding what's happening on the ground. It's one thing to see, like numbers and pretty charts, but it's another to see what these numbers mean for a survivor and their family and their safety. So I will read this story about a survivor who was assisted by a Vera in uh, going to a domestic violence shelter. It says, I coordinated a safe ride for a survivor in need of transportation to the domestic violence shelter where he had just been accepted as a client. While we waited for his car to arrive, he told me how grateful he was for the ride and how excited he was to finally have been linked to a shelter. He had been sleeping in hospitals, police stations, and different homes for the past 3 weeks. But with our help, he had the ongoing support he needed to find safety. In turn, I congratulated him on this new opportunity and praised his resilience in the face of his long wait for shelter. Once he was safely on his ride there, I reminded him that we would always be here if he needed further support. And so we see here how the important role that VERAs play in ensuring that survivors are getting their needs met after they have exhausted other avenues. In accordance with the growing demand for DV shelter, we are also seeing a growing demand for affordable housing. Affordable housing allows survivors to transition out of the shelter system or maybe avoid the shelter system altogether. In 2025, we saw an 85% increase in demands for affordable housing compared to 2024. And then in Chicago specifically, there was a 56% increase compared to 2024. We can contribute this growth, at least in part, to the network's growing housing assessment program, which helps callers enter Chicago's gender based violence coordinated entry system, and it was established in 2019. In 2026, we plan to track calls for the housing assessment program individually. And so we look forward in the future being to tell you specifically what portion of these calls are for that network program. We are also seeing a new normal in legal advocacy need. Need for legal advocacy services spiked following COVID. You can see in the chart that in 2021, requests for legal advocacy peaked, and that since then, that they are lower but continue to increase year by year. In in 2025, there was 9% increase in requests for legal advocacy services compared to 2024 in Illinois, and an 8% increase in Chicago. And though cases spiked in 2021, we are still seeing that there's an 80% higher rate for requests for legal advocacy services compared to pre-pandemic 2019. So we consider ourselves to be in a new normal where cases are significantly higher than they were before the pandemic. We are also seeing an increase in requests for direct financial support. In recent years, the hotline has seen a dramatic increase in calls requesting public benefits and financial assistance programs. And that boom in calls coincided with the launch of our Survivor Fund program. In 2025, we really wanted to see how much of those calls are directly attributed to the Survivor Fund, to survivors calling for information about the Survivor Fund. And so we added a new Survivor Fund code. We saw that interest in the Survivor Fund, quickly rocketed that service need to the top 10 list and makes up the majority of financial assistance requests. There were 2,162 requests for information about the Survivor Fund in 2025, and then 413 additional requests for other public benefit support across Illinois. We also saw that there were 2,362 requests for transportation across Illinois. This is the first year since the beginning of measuring safety that we tracked transportation requests specifically, and it also landed on the top 10 needs list. This isn't a surprise. We know that survivors need transportation to meet their dates, to get from a dangerous location to a safe location, to get to police stations, to get to hospitals. And so we see that there's a high need for transportation assistance amongst survivors, and that service code also quickly rocketed to the top 10 list of service needs. In this part of the presentation, we'll be talking about hotline programs that address survivor needs. The hotline has a collection of supplemental programs that work with survivors when they contact the hotline to assist them with certain types of needs, and we will get into those. In the fall of 2023, the hotline implemented a new process for firearm safety planning and data collection amongst contacts who experience gun violence. We started to ask survivors if they were experiencing domestic gun violence in their DV relationship. And in 2025, we decided to make that firearm question optional. We wanted to give survivors control over when and how they tell their story. So when you're looking at this data, it's a little bit different than it might have looked in previous in the past. It now represents the percentage of survivors who feel comfortable disclosing the threat of gun violence in their relationship. It does not represent the proportion of all callers who are facing gun violence. The network has also published a firearm safety planning toolkit, which can help guide advocates and direct service providers on how to help survivors safety plan for firearms. It includes how to request firearm relief when petitioning for an order of protection, and you can access that safety planning toolkit through our website or by scanning the QR code in the corner. Here we have a story of a Vera who assisted a survivor who was experiencing gun violence in their DV relationship. The Vera said, I texted with a survivor who was fearful of her ex retaliating against her for filing an order of protection. She could not afford a lawyer and had struggled to express herself in court, dealing with social anxiety and filing pro se. The judge had denied her an emergency order of protection, instead continuing the petition and setting a hearing for a 2-year order. Her ex had threatened her and owned firearms, leaving her so frightened that she asked us to take down his information in case he harmed her. While we could not do that, we could connect her to legal aid organizations that might represent her at no cost at the hearing. We safety planned at Lyft, including notifying her loved ones of the situation, making police reports about the recent threats, and creating a check-in system with other people in her life. We also talked about other resources. As our exchange ended, the survivor expressed that she was hopeful for the first time in a while. So we can see the importance of safety planning and being able to address all of the needs that survivors might have in their relationship, including their abuser's access to firearms. The hotline also operates the Safe Rides program, which arranges complimentary Uber Health rides for survivors requiring transportation assistance, pending on funding availability. Rides can pick up a survivor from a public location and drop them off to a safe location unknown to their abuser. Veras can monitor the trip as survivors travel and ensure they arrive to their location safely. In 2025, the hotline provided 1,934 Uber rides to 2,951 passengers. It covered more than 96,000 miles at a cost of more than $181,000, and the average cost of a trip was $51 to travel 27 miles. We saw in 2025 that survivors were traveling further away at a higher cost. There was 65% increase in miles traveled and an 87% increase in program spending. The overall number of rides provided decreased by 13%, but we are seeing that it is due in part to the fact that survivors are traveling further at a higher price. The Safe Rides program served 2,014 adults, 884 children, and 53 pets, and also provided 131 non-Uber rides via bus, train, and plane in 2025. We have a story of a Vera who assisted a survivor in securing a safe ride. It says, I took a call from a mother with 4 children who had been treated for injuries related to her abuse at the hospital. She and her kids were about to be discharged, but they did not have a safe place to go. I reviewed all shelters within 2 hours of their location and found that none had room for a family of 5. With nowhere to go, we pivoted to safety planning and identified her mother as a safe host for her whole family. The survivor's mom lived more than an hour and a half from the hospital, and after reviewing all local transit options, we determined that a safe ride was the most direct and cost-effective way to get them all there. Once the details were sorted, the family was discharged, and I coordinated a safe ride to pick them up from a nearby public library. While they waited for the car to arrive, I stayed on the line and talked through a range of other resources, including legal options and support groups. As the family packed into the car, I reminded them that they were always welcome to call us back if they needed anything further and that we are ready to answer their call 24/7. So we can see how the Safe Rights program really serves as connective glue for other services, allowing survivors to, allowing VERAs to ensure that survivors are getting to safety, while also connecting them to resources from other service providers that they may need. In the fall of 2023, the hotline joined as a program partner for the After Hours Order of Protection pilot program, which is a collaboration between the Domestic Violence Division of the Cook County Court System and Connections for Abused Women and Their Children, which is a gender based violence service provider. Through the program, survivors can file for emergency order of protection after court hours, which is 9 p.m. through 3 a.m. on the weekdays and 1 p.m. through 6 p.m. on the weekends. And again, this is within Cook County. In 2025, the VERAs with the After Hours program screened 1,745 callers for OP eligibility, referred 1,562 survivors directly to CAWC staff, and filed themselves 109 petitions for emergency orders when a CAWC advocate was not available. In addition to these type of operations in 2025, in response to Operation Midway Blitz and other ICE presence at DV courthouses across the county, the remote option for OP assistance was available via the hotline at all hours of the day as part of an emergency response to ICE that the hotline mobilized. Here we have an example of how the After Hours OP program has assisted a survivor. The VERA said, I answered a call from a survivor and her case manager, both of whom spoke Spanish. The survivor needed to obtain an order of protection because her ex was stalking her, sending her threatening messages, and directing unwanted attention towards her and her children. Though she was fearful of him, she was also afraid to go to the courthouse and file for an order of protection because of the potential presence of immigration enforcement officers. She was worried she would be detained. The survivor felt unsafe navigating that process on her own and needed support. I affirmed her feelings and fears, then let her know that due to ICE concerns, the hotline was supporting the remote filing of OPs through our after hours program as well as during the day. I coordinated with my supervisor to screen her for order of protection eligibility. Together, we also reviewed a list of legal aid resources and developed a safety plan. At the end of her call, she told me how relieved she was to not have to go to the courthouse while under threat of ICE. And we know that the presence of immigration is serves to intimidate and to silence immigrant survivors being able to access the After Hour OP program at their home allows them to secure their safety without having to undergo the threat of immigration enforcement and the harassment of immigration enforcement. Our last supplemental program, the crisis housing program, um, is an attempt to address the sorry, I'm so sorry. Is an attempt to address the ongoing demand for domestic violence shelter in Chicago. The hotline has been able to supplement the number of beds with temporary hotel stays when funding is available. The program is especially helpful to large families that might be unlikely to find a shelter with availability for everyone. And the crisis housing program is funded through September of this year by the Cook County Justice Advisory Council. We are actively looking for funding partners who can help continue this essential service past the fall. To guarantee that survivors receive high quality wraparound services while staying at the hotel through this program, the hotline partners with local DV agencies that connect with survivors and address their wide ranging needs. In 2025, the hotline provided 700 survivors with hotel stays. That's 338 adults, 280 children, and 82 pets. And just like in the Safe Rights program, these supplemental housing programs are especially helpful to families who can be assisted when other services might not have full availability for the whole family. Year over year, The hotline demonstrates that it plays a life-saving role in safeguarding survivors across our state. We see through our hotline data that domestic violence knows no geographic boundaries and that survivors all across Illinois are using the hotline to reach out for support. The hotline reminds us of all of the service that survivors seek as they flee violence and begin their journey towards healing and safety. And it's critical that the hotline maintain public and private funding for their essential services while ensuring that the safety net for survivors continues to expand. We anticipate that need for supplemental services will only grow in the next year as the impact of HR 1 reduces survivor access to public benefits programs like SNAP and Medicaid. So you can stay connected with us and with this report by I can't speak today. By downloading it on our website, you can also scan the QR code and download the report that way. You can sign up for our mailing list to be updated about future reports, and you can also find our district report database on our website as well. We really appreciate you taking this time to be here today. I'm going to move it to questions because we only have a couple of minutes. I already see some questions in the Q&A function. Erica Kogler asks, do contact counts include counts from direct service provider hotlines that the network manages?
I can take that, and then I know we have some members of our hotline team here, so I might open it up to see if Sylvia has anything to add. But the option for other service providers to forward their lines to the hotline is available if folks reach out and want to partner with us. We do receive forwarded calls from many organizations across the state. We don't have a way of tracking exactly who those calls are coming from, sort of through the anonymous structure of the hotline. But we do include all of those contacts since they do ring on our line in these numbers. Sylvia, is there anything, or anyone else from the hotline who's here, anything you'd want to add to that? Okay.
And then Erica also asked if the After Hours OP program is a Chicago specific program.
Yes, it is a Cook County partnership with the Cook County court system. So a little bit more expansive than Chicago. That entirety of Cook County is who can be served by that program. So.
And then if anyone has any other questions, you can use the Q&A function to ask them, or you can post them in the chat, and we're happy to answer any questions that you have.
I'll offer in these last couple of minutes as we're waiting for any other questions that come to mind, that we want to remind folks that there is really so much more information that you can take away from the report in full. This is a very abbreviated conversation relative to all the great details you can find in there. So if you're curious for more location-based information, if you're looking for how folks get connected to us and referral data, more on different services, or on other partnerships that we operate, because we did not even have a chance to talk about all of those. You can find all of that in the report itself.
Shelby, is it safe to assume that if we made a location-based request recently, that you all were likely tied up in getting this report generated, and perhaps that's why we hadn't heard back?
Yeah, that's a good question. The data request that we have on our website should generate an email directly to one of our members of our team. So if you haven't heard from us in, like, I would say 3 business days, feel free to follow up directly, because there could be an issue with the delivery system from that form to our inboxes.
Okay, we'll do so. Thank you. And then forgive me if you've already answered this question. When do you anticipate that the 2025 data points will be available in the district reports?
Good question. Yes, the data in the current district database is up to date with 2025 data. Just that title of 2024 is what needs to be changed. So we are in the final moments of getting the title, as well as some of the wording in those reports updated with our web developer partners. So my hope is that by the end of today, all of that should be clarified, but know that the actual underlying numbers are all correct. Okay. Well, I'm not seeing any other questions in the chat, and we are coming up on 1 o'clock. So thank you all so much for being here. We're so grateful for your time and your attention. And we know that the more folks who know about this great program, the more people we're able to connect with and sort of build out that survivor safety net. So thank you all for being here. And we hope you reach out if any other questions come to mind. All of our contact information is in the report.